Hello, good afternoon and good evening. Although people from all walks of life are affected by COVID-19, it is primarily the poorest and most vulnerable on the planet who are at risk. This is the case with indigenous peoples around the world, in cities or in remote areas. Globally, indigenous peoples number up to 500 million people in more than 90 countries. Their cultures and languages are unique and they maintain a close relationship with their environment. Like other vulnerable groups, indigenous peoples face many challenges. These range from lack of political representation to economic marginalization to insufficient access to health, education, and social services. Indigenous peoples often bear the brunt of poverty, unemployment, malnutrition, and communicable and non-communicable diseases, making them more vulnerable to COVID-19 and its severe consequences. Although COVID-19 poses a risk to all indigenous peoples globally, WHO is deeply concerned about its impact on those in the Americas, which remain the current epicenter of the pandemic. Thus, as of July 6, more than 70,000 cases had been notified among the indigenous peoples of the Americas for more than 2,000 deaths. More recently, at least 6 cases have been reported among the Nahua, a population of the Peruvian Amazon. The WHO Regional Office for the Americas has just released recommendations to prevent and respond to COVID-19 among indigenous populations. WHO is also working with the coordination of indigenous organizations in the Amazon basin to step up the fight against COVID-19. Contact tracing is one of the primary tools for suppressing transmission within indigenous communities, and all communities. No country can bring its epidemic under control if it does not know where the virus is. As we have said time and time again, so-called containment measures can help reduce transmission, but not stop it completely. Contact tracing is essential to find and isolate cases and to identify their contacts and place them in quarantine. Mobile apps can be useful for contact tracing, but there is no substitute for direct presence in the field, trained agents who go door to door to find cases and trace contacts, breaking the chains of transmission. Contact tracing is essential for every country, in every situation. It can prevent isolated cases from giving rise to clusters which in turn will lead to community transmission. Even countries with community-based transmission can improve the situation by breaking down their epidemics into manageable pieces, which is all the more crucial as countries open up. Responding quickly to new cases and clusters of cases will allow them to continue on the path to economic recovery, while keeping the virus under control. Of course, contact tracing isn't the only tool, it must be part of a complete package. Nevertheless, it remains one of the most important tools. Contact tracing has long been the foundation of the response to outbreaks, from smallpox to polio, from Ebola to COVID-19. There are lessons to be learned from the recent Ebola outbreak in Eastern Democratic Republic of the Congo, which was declared to end last month, including that contact tracing can be done even under the most severe of circumstances. Difficult, with security concerns. When the Ebola virus was discovered in the city of Butembo last year, experts wondered whether it would be possible to bring the outbreak under control. Yet unexpectedly, the outbreak was halted in large part because the government, WHO and partners invested heavily in contact tracing, isolating suspected cases and treating those who became ill. In many cases, trained contact tracing agents, working closely with local leaders and communities, have followed the trail of the virus, sometimes for hundreds of kilometers through very difficult territory. Ebola and COVID-19 are caused by different viruses, but the principle is the same. No matter how serious the situation, there is always hope. With strong leadership, community participation, and a comprehensive strategy to eradicate transmission and save lives, it is possible to stop COVID-19. We don't have to wait for a vaccine. We have to save lives now. Make no mistake, we need to continue to accelerate vaccine research, while doing more with the tools at our disposal.